Hi, I'm Dr. Christopher DuCoin, Professor of Surgery at the University of South Florida and Chief of GI and General Surgery. I'm an esophageal surgeon, and we wanted to make a video to explain the treatment options for achalasia. Achalasia is fairly complex. Essentially, your esophagus doesn't work the way it's supposed to. Your esophagus has a couple roles and key responsibilities, one of which is to take food from the mouth to the stomach in a very organized and coordinated manner. It's called peristalsis, or pushing the food and liquid down. The next is the lower esophageal sphincter. The muscle between the esophagus and stomach is tight all the time. Now, when you start to swallow, it relaxes, opens, and allows food to pass. These are mechanisms of the esophagus, and unfortunately, in achalasia, these really don't work. There's no push down, and the lower muscle never really relaxes. This leads to a lot of difficulty swallowing or dysphagia and food stacking in the esophagus. Now, we've got treatment options that can help, and from a surgical approach, there's two main ones. One is called a classic Heller myotomy, and the other is called a POEM, or a per-oral endoscopic myotomy. Now, it'll depend on what type of achalasia you have. Usually, for types 1 and 2, when the issue is mainly with the lower esophagus, we're going to recommend a Heller myotomy. Type 3 achalasia is more spasms, and we're going to recommend probably a POEM. We're going to figure this out when you come to clinic. Both approaches are very, very safe, and while we relax the muscle at the bottom of the esophagus, we are going to allow food to drain much better, go into your stomach. This will improve both quality of life and survival. What we don't want to have happen is food remain in the esophagus, stack up, and end up in your lungs. This is called aspiration pneumonia and can be devastating. So we've got our treatment options, Heller myotomy and POEM. We'll help come up which is the best one for you. Now, the operation itself should take less than about an hour for both of these. You will stay 1 night or 2 full days in the hospital. After your procedure, you'll get what's called an esophagram, where you drink some contrast, and we take x-rays to make sure everything is perfect before you go home. Your post-operative diet is going to be 4 days of full liquids. That's protein shakes, smoothies, and ensures. We want really just liquids going through that repair at the beginning. After that, we'll move you to a soft diet for about 2 to 3 weeks until you come see us in clinic. And that soft diet's going to be things such as eggs, grits, mashed potatoes, that level of consistency of food. You can even maybe get up to flaky fish. Now, we won't try meat, bread, or uncooked vegetables for some time until everything's healed in place. Unfortunately, with achalasia, there is no cure. And while we can improve quality of life and decrease the aspiration risk, we might never be able to fix things totally. And while we'll focus a lot of energy on that lower esophageal sphincter, relaxing it, there's nothing that's going to make that peristalsis get better. Because of that, you're going to be a patient for life. Either myself or one of our gastroenterologists will keep an eye on you as time goes on. We want to make sure your swallowing function remains intact. If there's any issue with swallowing after the operation, we've got other treatment options to help you. We'll talk about those more in detail. I just want you to know that you will be our patient and we will take care of you as long as it takes. I'm passionate about this disease process and I want the best quality of life for you. Thank you for trusting me, and I look forward to meeting you.